What is reference pricing? Reference pricing means that the price of a medicine is determined by benchmarking or comparing it to the prices of other countries or similar drugs. There are two different types of reference pricing: external reference pricing and internal reference pricing. External reference pricing is used by policymakers of a country to set the price of a newly approved medicine by comparing the prices of the same medicine among countries with similar characteristics. Sometimes the price is set equal to the lowest price in the countries used for comparisons, and sometimes it is set equal to the average price in these countries. Each country uses a unique basket of reference countries and formulas. This international comparison of prices has downsides. Since all payers would like to have the lowest price, it may create a race to the bottom. To avoid this, pharmaceutical companies first launch the new medicine in countries with a high national income that can afford the high price. And they delay the launch in countries with a lower income that can only afford a lower price. That means that for new medicines, the only existing prices to be used for referencing are higher prices. Furthermore, external reference pricing incentivizes the pharmaceutical industry to keep price differences between countries as small as possible to avoid parallel trade. Resale of a drug, first purchase outside the country without the permission of the company that holds the intellectual property rights to resale it. As a result, in countries with a lower income, prices of medicines are relatively high compared to prices of other healthcare services. So to summarize, despite their greater health needs, patients in countries with a lower income have more limited access to innovative medicines because of three reasons: lower affordability of medicines, lower availability of medicines due to delayed launch, and lower availability of medicines due to parallel trade. The second method of reference pricing is called internal reference pricing. This means that the price of a medicine is set with reference to similar medicines within one country. Medicines that are deemed comparable are clustered into one group, and a maximum price per group is set. This maximum can be based on the cheapest medicine in the group, and if the medicine with a higher price is prescribed, then patients often have to pay the difference out of pocket. Internal reference pricing can be used for both brand drugs as well as generic drugs. And in some countries, brand drugs and generics are clustered into the same group to drive the price down. A generic medicine is the same as the original brand medicine, but it can only be sold after the expiration of market exclusivity of the originator. In reality, though, the price of an innovative medicine, that is the first in a new class of medicines, is often based on a combination of external reference pricing and price negotiation with the manufacturer. The price of a new medicine in an existing class is often based on a combination of external and internal reference pricing.